Right, so just last week, NYU Langone Health sent out an email urging their patients to come in for essential inpatient appointments. This comes after doctors say there has been a massive drop in patients visiting, and now they worry that avoiding medical checkups could lead to some potential danger. So joining me to talk about this is Dr. and Executive Vice President and Vice Dean of Chief of Hospital Operations at NYU Langone Health, Robert Cerfolio, to tell us more about what they are doing to help in this situation. So Doctor, we thank you for joining us. I think the thing that is most concerning to folks is if I go in for one of these essential checkups, am I risking getting the coronavirus?
Well, thank you very much, Betty, and thank you for the opportunity to come to you and talk to you and make people feel safe, because really that's what it's all about, isn't it, Betty? It's about our families feeling safe, us feeling safe, and where can we go? And the safest place in the world to go is the hospital. Now, right now, people don't see it that way. They don't see it that way because they think the hospitals are full of patients that have coronavirus and they're going to get infected. And of course, there are patients with those diagnoses in our hospital. But who better to know how to test patients, how to cohort them, how to provide safety, and how to use the proper PPE to protect you. In fact, we have data that shows that our healthcare workers have maybe a lower incidence of getting coronavirus than you would out in the community. And that's because we understand the disease. And the problem is right now, people are...
Well, that's good news. Yeah, let me ask you this, and I just want to stop you and interject here because as they're hearing this from you, that it's a safe place to go and the protections are in place. Is there a greater risk if people avoid these essential appointments, these necessary checkups, because their health could be being put at risk in another area that is not even coronavirus related?
That's right. And that's right where I was going, Betty. So it's a perfect segue. Yes, there are people sitting at home having chest pain, afraid to come to the ER because afraid they're going to get, coronavirus on top of their heart attack. And by the time they come to the hospital, their heart attack has evolved and it's much more difficult. That's true for stroke. That's true for appendicitis. We're seeing more and more patients who have sat on right lower quadrant pain for 3-4 days. And instead of having an easy appendicitis, an appendectomy where you go home in a day, they now have a perforated appendix and they have all types of problems. So they're delaying their care out of fear of getting the care they should be getting. And that's the real problem we want to address today.
But what about people sitting at home going, okay, I'm not sure if what I'm experiencing is urgent enough, essential enough. So how do you make that differentiation?
I would say you make the same differentiation today as you did 3 or 4 months ago. We were seeing 300-400 people in our ER a day here in our Manhattan campus at NYU Langone. Now we're only seeing 100. And we're seeing patients come in they've been sitting on symptoms of strokes for several days instead of coming in when they used to. And the same thing with heart attacks, chest pain, abdominal pain. They're neglecting their health. And this is the other part that the COVID-19 is hurting people. It's not just the disease, but it's the effect it's having on all our other ailments.
Absolutely. And, when we talk about these elective surgeries, how do you know what is time sensitive for an elective surgery and when should that be started?
That's a great question. Really, only you and your doctor can decide that, because what may be elective may be actually semi-urgent or delayed. For instance, if you have a cancer, what's the risk of waiting? That cancer could spread or cause other morbidity. I'm a lung cancer surgeon. Maybe I have to take more lung out, or now there's a lymph node that's positive because we've delayed. So cancer operations, but even things like, say you're having knee pain that's severe, and now you're becoming addicted to opioids because you're not getting the operation you need. So there's many examples of people delaying the care they should have out of an irrational fear. The hospital is the safest place in the world. It's safer than your grocery store, yet people seem to be going there with no recourse. Come to the hospital. If you have a problem, we're here to help you.
That's a very good point. Dr. Cerfolio, perhaps we're saving lives today, right? Making people feel a little more comfortable about going to the hospital when it's not coronavirus related. We thank you for your time and your insight.
Thank you, Betty. Thank you. Have a good day. Thank you.